Does it feel like your face just fell overnight and all of a sudden you're noticing fine lines and crepiness? And what the heck is going on with everyone asking you, why are you mad or why are you so tired when you really feel good on the inside? I'm Dr. Mary Osmina. Welcome to my channel, The Skin Reel. This week, I am talking all about the menopause makeover. Yes, ladies, we are finally talking about menopause and not in the way that I used to think of it, where it seemed all doom and gloom. It was the end of our life as a vibrant woman. We are talking about how women can have their best skin yet in this period of life. I'm joined by cosmetic and laser dermatologist, Dr. Pooja Rambhia. She's a board certified dermatologist. She practices at Union Dermatology in New York City and Greenwich, Connecticut. She's going to be going over her menopause makeover blueprint to help women in midlife have the most amazing skin possible and to feel amazing in their skin. And guess what? It all starts from the inside out. But we're going to also share some dermatologist approved tips to help keep that skin glowing with products, injectables, and lasers. If you're curious about a menopause makeover, you're definitely going to want to check out this episode. Dr. Rambia, I am so excited to have you on. I read your article in Marie Claire about the menopause makeover, and I was like, I have got to have you on the skin reel to talk about this because it just seems like, I want to know what it is. And I'm kind of approaching that period of my life, so I'm especially interested. So thanks for being here.
Thank you so much for having me. Such an honor to be on here. I love to talk about all things cosmetics, lasers, and energy based devices. So, this is going to be a real treat for me.
Yes, awesome. Well, so I introduced you a little bit before, but I would love to know what exactly is a menopause makeover? Because I think a lot of people have heard of mommy makeovers. I remember those seemed to be really big, like maybe 10 years ago, but I'd never heard about a menopause makeover. So, what is that?
So, yeah, menopause makeover, it's kind of this newer term that we've coined to really describe refinement and rejuvenation of the mind, body, and, just like overall health. I think it's becoming, much more mainstream. And I think traditionally menopause has had such a negative connotation, really because of all the ramifications of, what can happen from the hormonal changes as far as the decreased collagen and elastin, the dryness, lackluster skin, hair loss, brain fog, et cetera, et cetera. And I think that this term really reflects a shift in mindset. It's really about retaining your vibrancy and really optimizing your health as your body's going through these natural changes rather than kind of just accepting the decline of menopause.
Right, or just feeling really, like, despondent about it and negative, right? Because I have to admit, like, I didn't think anything good came out of menopause. I would think, "Oh my gosh, that just means, by the time I get to menopause, like, I just forget it, like, it's over." And now as I'm, getting closer and closer, I'm like, I love that I'm seeing women, they're not afraid to talk about it, like it's a four-letter word, right? And we're realizing, okay, these things are happening, but we can still be vibrant women, right? Like we're really just in the middle of our lives. So what can we do to, navigate this season, right? So what are some of the things involved in a menopause makeover?
So, I think a menopause makeover, it's really important to kind of look at how the body is changing kind of holistically. So, from an aesthetic standpoint, which is, my particular interest, we're losing about 30% of our collagen and elastin, content in the skin and within the first 5 years of menopause, which is really drastic if you think about it. And so, what are the effects of this? Well, one, there's going to be dramatic loss of structural support of the skin, which is going to result in loose, saggy skin or skin laxity, as we refer to it, significant volume loss. And so, these two things in combination are really going to result in the formation of the dreaded nasolabial folds, marionette lines, jowls. And so, from a skin standpoint, as far as, what are things that we can do to really prevent that or really optimize our the appearance of these things, injectables, biostimulatory injectables that we'll probably get to talking about a little bit more later on, laser resurfacing, really optimizing skincare at home with retinoids, AHAs, BHAs, sun protection. And then I think beyond, I'm doing as a dermatologist in the office are really thinking about the systemic effects of menopause. So, hormone replacement therapy is something that's been more in vogue recently. And I think that there is really a lot of benefit to it. It's not something that I particularly specialize in myself, but are often referring my patients to my GYN colleagues who are in support of it and practice it on a daily basis.
Well, I think it's so eye-opening because I just thought estrogen was important for ovaries and babies and all that, right? But we've now realized, oh my gosh, like it's key for your brain, your gut, for everything, heart, endocrine, like you name it, right? And we're seeing the ramifications because like my mom's generation, they weren't put on hormone replacement therapy, right? So they now we're seeing all the other issues that happen well beyond just, the GYN things you might think of. And yeah, I remember studying estrogen receptors on the skin in medical school. So I always get a kick out of like, wow, it's coming full circle. All those, immunohistochemistry studies I did and stainings that yes, our skin has estrogen receptors. So it does show when we have that depletion, it does show in our skin. And I think a lot of times the skin is one of the first things women notice because I feel like 40 is sort of a big change for a lot of women where like my friends or patients will say, I was doing fine until 40 and now I'm starting to notice things even though they may be, 10 years from menopause, right? But those changes can happen earlier.
Yeah, I think you kind of said it in your 40s, it's things are really starting to change very subtly. From my perspective, patients are coming in and telling me that they feel like their skin just doesn't look as bright and glowy as it once used to. They feel like their usual skincare routine really isn't working for them anymore. Like their foundation is settling into lines, their skin texture is changing. It just feels rougher despite using those same products. And I think, as time goes on by their 50s, those changes are becoming way more pronounced, right? Your jawline is really starting to lose definition. Your neck is showing signs of crepiness. And there's this just overall volume deflation, especially in the cheeks and temples. What's interesting is women will often come in saying that they feel like they look super tired despite the fact that they're well rested. And that's really the effect that volume loss and textural changes really working together.
Or they'll say, like, I people think I'm really angry or upset all the time, right? With, like, scowl lines, and they're like, I'm not angry, I'm not upset, but people perceive me that way, and that's not really the way people wanna be seen.
Absolutely. I think it's important to also just put out there that, while a lot of this are the effects of those hormonal changes, it's not just hormones at play, right? Like, I think, it's also that cumulative sun exposure that you've had over time, your sun protective habits, your genetics too, and, the preventative procedures that you may have done or may not have done in your, early, late 30s, early 40s, things like that. So I think all of that together, comes to show at that stage.
Absolutely, and, for me personally, you go to med school, you do residency, you're starting a family, like, you're burning the candles at both ends, right? And that's sort of like the environment we trained in, right? And then I realized, like, wait a minute, I can't get by on, like, 4 to 5 hours of sleep and eating just, like, crappy food and not exercising, right? Like, I felt like, okay, I really need to make some changes if I wanna be really healthy for the next, like, half of my life. You had talked about some, like, preventative stuff, but what if you are hitting menopause or in that area, you've never done anything? Is it too late, or is there things you can do? Like, how do you approach someone like that?
I never say it's too late. I do think somebody who's more proactive and preventative in their approach will age better over time, but that doesn't mean that it's too late. I think a nice place to start for a lot of women is really just with good skincare, and that's something that I really like to touch on during my consultation with patients. I think the aesthetics industry, especially nowadays, it's very overwhelming for the cosmetic naive patient coming in, and so that's really the time where I get to learn what, they've been doing skincare wise. We'll make certain recommendations. A lot of times I find women as they're, going through perimenopause and menopause, their skin barrier really does change, and we know that, and that's been studied and shown. And so I will make the switch to more like to less aggressive actives. I find those women are, less able to tolerate retinoids from the get go. And so we'll start them out on milder forms of a retinol and really, try to shift their mindset because, they've been using the same products for years and years and have never had an issue, and they're coming in and their barriers clearly compromised. A lot of times, I'll see that with fragrance skincare products, and so that's really where I start to just make the change, add in a vitamin C serum, really kind of emphasize the importance of sun protection, and then we'll start to I don't like to overwhelm patients with, like, all of the things that we're going to do and start them out with injectables. I think neurotoxins are a really easy way, to kind of introduce patients into this world of procedures and things that we can do to, help them age as best as possible.
Yeah, no, an ounce what is it? An ounce of prevention is worth a pound of cure, right? Like, preventing things and maintaining your skin and healthy lifestyle habits and all of that is so impactful, but yeah, it's never too late, but it can be a little bit, a little bit of a steeper climb sometimes to but I totally agree about, like, just getting a good skincare routine, right? Like, if you just do nothing and, like, just start with that, that can make a huge difference. There was a one of my patients sent me an article, I think it was the Wall Street Journal, about a man in his I wanna say he was 70s, and he'd really never done anything for his skin, but after having, like, a 10 skin cancers or something like that, he decided to I don't know if you read this, he decided to start a skincare regimen, and he tried all these different products, and he was saying, "I didn't think it was necessarily working, but people were stopping him or commenting like, "Oh, your skin looks good," or "You look refreshed," or, "You look like you just got back from vacation," right? So he could tell, like, just doing skincare made a difference, and I just want people to know, like, skincare doesn't have to be expensive, right? Would you agree with that statement?
100%. I am such a minimalist when it comes to skincare products, and I tell my patients I get sent the fanciest creams and products, and I really don't think it's necessary at all. I think for patients who enjoy kind of the luxury aspect of these fancier products, I think, and they enjoy that part of their routine, go for it. With certain caveats, if they have more sensitive skin, I really don't think fragrance La Mer is like going to be the best product for them. But yeah, I think there are very few skincare products that I would spend money on. Vitamin C serum is really the main one, I would say.
Yeah, just 'cause it can be kind of, finicky processing and stuff like that, but yeah, I think sometimes people think, "Oh, skincare, that means, hundreds of dollars for a moisturizer and this and that," and certainly you can find products in that range, and right, like, I am not one of those people, but some people just truly love that, and if that's you and it doesn't hurt your wallet or your skin, but don't feel like you have to do that. It doesn't have to be complicated, right? And I think all dermatologists, we're always telling people, like, it can be pretty simple. In fact, it should be. So, I love starting with the skincare and then maybe starting with some injectables. I joke that Botox, toxins, it's a gateway drug, right? Like, it's a way to dip your toe in the cosmetic arena, see if you like it. I think most people do. It's like a pretty high success rate. But it wears off if you don't like it, right? It's not permanent. You're not changing how you look permanently.
I think injectables, particularly neurotoxins and menopausal women, is something that's not necessarily so straightforward. And the reason I say that is when patients are younger, they're often we're focusing on specific things. For example, right, their crow's feet, their 11s. But as women go through perimenopause and menopause that skin laxity is really starting to set in. A lot of them are having their brow position is decreasing. They're becoming a lot more frontalis dependent to really elevate their brows and make them look awake and open and engaged. And so the result of that is more forehead lines. And so I think for the inexperienced practitioner, one may think, oh, there are more lines, so you're going to increase your neurotoxin dose and the patient will be happy. But oftentimes it's really the opposite of that, right? Like you end up feeling way more heavy and looking more tired, which is really the opposite of what you want to do. So I think really talking to patients about where I think they really need the neuromodulator to best kind of elevate their brow, make them look more awake and refreshed is so important.
Yeah, I'm glad you brought that up. I was gonna ask you about that, if you how you change it, because I find I use less and less on my more mature, ladies, because if you are listening, you can see if you're doing this yourself. Like, look in the mirror and are you raising, are you pulling your eyebrows up so you can see clearly? And a lot of people do it, they don't even realize it, right? It's just so natural. And then if we were to paralyze that muscle, then your brow isn't necessarily drooped, it's at its natural position, but that's gonna feel lower, and people don't want that look. So, yeah, I absolutely go very light on the forehead lines, sometimes don't even do them, right? But that is a really important caveat to mention that you can have more complications. It's not as forgiving, is it? Are there other areas you like to treat with, neuromodulators, toxins in more mature patients?
I think the Nefertiti and, like, addressing the neck is so important. So for those listening, doing small amounts of toxin kind of along the jawline into the platysma muscle, as well as addressing the platysmal bands, I think is really important because, that muscle is really pulling down on the jawline and the lower face, and that can really exacerbate the appearance of jowls, which are forming on their own. And so I think adding some neuromodulator into the platysma and into the jawline can really help to minimize the appearance of that and really help the jawline look as sleek and snatched as possible.
The neck, that's a big area. I feel like that my friends and I are starting to notice looks a little different, right? But doing some toxin into those vertical bands on the neck, especially under the jaw, it can really make a big difference. And I always like to do a little bit what we call the DAO, sort of where the corners of the mouth, a little below that. I find that's no one really comes in like asking, right? But I'm always like, "Let me give you just a little smidge." So I enjoy that too. I do find I think we've sort of discussed it without naming it. I do feel like I focus more on the lower face in my more mature patients than the upper face, right? Like, it seems like I do less on the upper face with the forehead and more on the lower face with the jawline and neck.
I would agree with that, with the one exception being masseters. I think I'm much less likely to inject masseters on a more mature patient just because I think they really are relying on that support for their lower face. Not every patient, but I think the majority probably are.
Yeah, and just for people who don't know what masseters are, where can you say where those are?
Yeah, so the masseter muscle, one of the muscles of mastication, and it contributes to it provides support, structural support to the lower face. And a lot of women, particularly, I will say Asian, Southeast Asian women, Indian women like myself, will have more hypertrophic or larger masseter muscles at baseline. And by injecting them with neurotoxin, you can really help to kind of chisel out that area, add more jawline definition, and give you more of this like heart-shaped, lower base, which is traditionally considered to be more youthful. But as patients get older, they really, your bony support kind of diminishes over time, and so you really become more reliant on those muscles to kind of provide that support to the lower face. Why, I think injecting it, unless there's, like, true TMJ, I think injecting it for aesthetic purposes, it's kind of diminishing returns the older patients get.
Right. I think I saw some, like, TikTok videos saying, "Never inject your masseters because it'll make your jowls worse," which isn't, if you're 20, that's not the case, but perhaps if you're 50, 55, 60. Yeah. So good point there. Now, we had mentioned, fillers before and biostimulants. So I think a lot of people notice the volume loss. They feel like I'll hear my face is falling. It seems really flat. I used to have cheekbones up here and now I don't. So how do you address the volume loss in menopausal ladies?
Yeah, so, our major options are going to be our traditional hyaluronic acid fillers, which recently, as you'll know, have had kind of a bad reputation versus the biostimulatory injectables, things like Sculptra and Radiesse. I think for, my more perimenopausal, menopausal patients that are really noticing that kind of global volume loss, I do tend to lean more towards the biostimulatory injectables. I love Sculptra in the face. I love Hyperdilute Radiesse in the neck, although you can do either in either location. But I think they're really great for more of that widespread volume loss, not just isolated areas. Traditional fillers are great for that targeted correction, but I think when you're looking for more global, upper, mid, lower face volume loss, plus also skin quality changes, I do think biostimulatory fillers will give you more of that gradual, long lasting kind of benefit. But which isn't to say that the two are mutually exclusive. I often will combine both. I have a patient who I've been doing some Sculptra on, and she's doing great with it, really responding well, loving it. And, we're now layering in some hyaluronic acid filler to volumize her lips and the chin area. So, there really is a place for both, but it kind of just depends on what we're really focusing on.
Yeah, it's not all or nothing, right? But I do find like if you're thinking I'm going to need 10 syringes of hyaluronic acid, it's time to think about biostimulants. And my business partner does fat grafting, which I do feel like is starting to come back a little bit, using your own fat and removing it from like your abdomen or flanks and then putting it back in. But yeah, I do think that more like pan global facial volumization. I'm a big fan of biostimulants. I've got my sister Hook. She comes in for her annual Sculptra sprinkle. No, for maintenance, but it sometimes is a hard sell for patients when I tell them, "Okay, I'm gonna, put 1 vial in or 2 vials in, but you're gonna look amazing for a couple days, and then that water's gonna go away, and you're gonna look the same, and then in 4 months, it's gonna start building your collagen." So, it is playing more of the long game. You don't get that instant gratification that you do, but, I think it pairs really nicely with the HA fillers, especially it doesn't give that sort of stiff chipmunk cheek, which I think a lot of people are really afraid of. Well, and I also have to tell my patients too, like, you don't see good filler, right? Like you only see the bad filler because the good filler you don't notice, right? And that's really like my goal with patients. And I don't want to speak for you, but I imagine knowing your work is that we aren't necessarily wanting people to look done. We just want them to look really amazing.
That completely resonates with me, and it is really my goal with my patients when we talk about that during the consult, because I think that expectation, matching is really important, when finding a great doctor-patient relationship.
Yeah, well, and I'm glad you mentioned that too. Like none of these are like one visit things, right? It is not don't think you're going to go in and have one visit and like your life is all changed. Like it really is a relationship. It's kind of a commitment with each other that I'm going to be here for you and here's kind of our game plan based on like what your goals are, but these are not quick fixes, right? And I think if someone's promising you a quick fix, then, you have to a little word of caution even with surgery, right? Like, surgery is still is a process, right? So just be aware of that. Now, what about lasers? Because I know you do a lot of amazing laser work. Like, do they have a role in the menopause makeover?
100%. I am a laser, gal. I love my lasers. And I think, as far as like which laser, I think patients think laser is like one procedure. But the reality is there are hundreds of different types of lasers. They have different technology behind them. We use them for different clinical indications. And I think, choosing the best laser modality for a patient really depends on what, their specific concern is. I think, if we're dealing with more of those significant atchritis, CO2 is going to be the answer more times than not, unless, it's a patient with melasma, darker skin type. We have to be a little bit more cautious about things like that. For patients who are more concerned about reds, broken blood vessels, vascular lasers are always a home run. Pigment, then we're talking more picosecond, Q-switch alexandrite lasers. But in general, for the menopausal patient, for that overall rejuvenation, I'm really leaning more towards a fractional beta of CO2, or, for my patients who really don't have the downtime capabilities for that, really, Fraxel Dual is one of our workhorse non-ablative resurfacing devices. And even now, the newer focal point technology with the Myria device, those are really excellent options for skin rejuvenation. What I love about these options is that, specifically these resurfacing options, is they're not only for improving, the texture, the, fine lines, scars, wrinkles, things like that, but there's also a health benefit. And that's been studied, that they can really reduce the risk of a subsequent non-melanoma skin cancer. So, I always have a conversation with any of my menopausal patients coming in about really the dual benefit of lasers in their treatment armamentarium, moving forward.
Yeah, and you're right, like, laser is not one thing, and I still just think of the Austin Powers movie and, like, the sharks with laser beams every time I hear that, but, yeah, I think everyone thinks lasers and then energy-based devices, right? They're things that we think are lasers, but they're really not, so there's so many things out there that it is overwhelming for people, and I would just encourage someone, like, trust your dermatologist, trust who you're working with. It's less so much about, like, the brand name device, right? And it's more about who's holding that device, and do they know how to, adjust the settings beyond just the pre-programmed ones that are there and can assess the endpoint. And, I think sometimes people think, "Oh, it's just, you just click a button, right? Like, how hard can it be? The screen tells me what settings." But if you really want really impactful results, you're gonna see someone who knows how to tweak it beyond just the preset settings and has that knowledge. So yeah, it's less so much the brand name and more who's holding the laser. And it depends on what you need, right? Just because your best friend had one laser doesn't mean that's, the right one for you. So you have to think about what are you trying to treat and address, for sure.
It's funny you mentioned that, because I've had, a couple of instances where I've had, like, best friends come in individually, and I'll see one patient, and, we'll do a consult, and they'll start their treatment plan, and they'll be really happy, and then their best friend will come in and expect the same exact lasers, injectables, energy devices. Meanwhile, their anatomy is so wildly different, and so the consult is going to be different, and what they're concerned about is different too. So we tell every patient coming in, like, it's really important to, trust your physician, and really, be thoughtful about what devices, and injectables you're moving forward with. I think that's important.
Right, absolutely, and I'm glad you brought up about how these lasers can reduce the number of precancers and even some non-melanoma skin cancers because it's in this age period, right, where we start I mean, you can see skin cancers even earlier, but I feel like 50 plus is kind of when, people start to notice some skin cancers, precancers, things like that, and I'm sure you've seen this too. I've seen so many people with melanomas that have been lasered by someone who was not a dermatologist, was not a physician, and, it's scary, right? So sometimes, that's why I love telling people to see dermatologists, right? Because we are also experts at diagnosing the skin and we can say, "Wait a minute, this brown spot isn't an actual just sunspot. This is actually a melanoma. We need to actually biopsy it," or, "This is a basal cell, a squamous cell," et cetera. So that's something to be aware of too that starts to show up on, our skin as we get older too. What about so we talked about, like, skin laxity. I'd love to get your thoughts on tightening devices, right? Because the loose skin, the loose neck, the gels, like, all of this, I see patients and they could benefit from a neck lift or a lower facelift, but they just don't want the surgery. So what are there tightening devices, in your opinion, that can have some benefit?
Totally, but I will say the most important part of this conversation is talking to these patients who are most likely surgical candidates about their thoughts on surgery. Because if they're even, if they're interested in surgery, which I know is different from the question you posed me, but I'll just say this: if they're either interested in surgery or surgery curious, I do think it's really important for them to have a consult with a surgeon, and I'll often refer these patients because again, the gold standard for skin laxity is going to be surgery. And I think, if they are going to move forward with surgery, I tell them save your money and let's focus more on like improving skin quality with lasers and things like that, things that surgery won't address. Now, for the patients who then are not interested in surgery, I do talk to them about all of the different non-invasive tightening options available. Some of my favorite devices, the ones that I think really do work, Ultherapy, microfocus ultrasound, Softwave, which is, a newer generation ultrasound device that is more superficial than Ulthera. And there are certain differences in the ultrasound technology, but I do think that those devices really will help to tighten the skin. I do think those that have kind of that deeper set laxity will need the Ulthera over the Softwave. Those that have more of that superficial crepey skin would benefit more from Softwave. And oftentimes patients have both, and we do both in the same session too. One thing that I do like to do, and this is something that I learned from some of my attendings during fellowship, is combining biostimulatory injectables with these energy-based devices on the same day, and there is data that shows that you can get a little bit of a synergistic benefit. The one thing to kind of keep in mind, and I tell these patients, these treatments are costly, they're expensive, and so it needs to, resource-wise make sense for them. But in general, more is more, meaning the more sessions that they're able to do, they will see more of an improvement. Not everyone will respond the same way. I think it's really important to make sure that they're optimizing themselves holistically, having a really great diet, eating enough protein, sleeping enough. I think those are the patients that tend to respond better to these, sorts of interventions. But I tell them, like, it's not a facelift result. And anyone who's coming in is like pulling their face up and is like, this is really what I want to look like. I tell them they're not going to be happy with, skin tightening devices. And we have a really thorough conversation about that because the last thing that I want to do is have them have spent thousands of dollars with me and then, there's a subtle improvement, which I tell them will happen, and it's not what they were looking for. So that expectation mismatch really needs to be clarified at the consult. But I tell them plan for like 20 to 30% improvement.
Right, exactly. Yeah, it's all about expectations, right? If they are pulling their skin back, then you want to just make sure they know that really is surgery, right? Like that will 100% get get that skin gone and tightened. So you just have to weigh the pros and cons and I think having a conversation with someone about surgery is helpful, even if you really don't think you're going to do it, right? Just so you can weigh all your options because these treatments are expensive and it's not like the tightening ones are necessarily the quick, easy, cheaper option either. So You just need to make sure you're investing your money wisely and that you are aware of what these devices can and can't realistically do. So I think that's huge. What do you do when someone brings in like a picture from when they were in their 20s, right? And how do you navigate that? Because I guess how I do it is I just try to encourage people like we're gonna look different, right? Like we're not gonna look like I don't look like I did when I was 20 necessarily, and in my 60s I'm not gonna look like now, right? But different doesn't have to be bad. So just how do you approach that?
Well, I always tell them, I always get a little laugh out of this, that comparison is the thief of all joy, and you look like the relatively best version of yourself now compared to 20 years from now, you know what I mean? And, I think I've experienced this myself and, I'm younger, I'm in my early 30s, but when I was in my 20s, I thought I looked terrible, and now I look back and I'm like, "Oh my gosh, like, I looked great then." So, I always try to, like, shift the narrative a little bit, kind of in a gentle way and get some laughs out of it, and then really focus in on what are the changes that have happened from age 20 to, say, age 50 when you're coming in to see me, and what are things that I think we can tangibly correct, and I say that with air quotes because, we're not trying to bring you back to 20, we're trying to bring you back 5 years and really just make you look like the best version of yourself today.
Yeah, absolutely. Why is it that we can't appreciate how we look in the moment, right? Because I've had pictures from 10 years ago where I thought, oh, my face was so round and I didn't, and now I'm like, oh my gosh, I would love that fullness, right? So it is a mindset shift, right? And we kind of touched on that in the beginning. Like, how are you going to look at aging, right? And we have to kind of reframe it because in 5 years, you're going to wish you could be back where you are right now. So how can we learn to appreciate where we are in this moment and not necessarily lament, how we looked in our 20s, right? And just try to focus on being the healthiest and having the healthiest skin and feeling our best now. So I love all these tips, all this advice. If someone listening is starting to notice some changes, like what would you recommend that they do? Like first off.
I think coming in for a consultation is really the most important thing because a lot of times you will, as a consumer of, aesthetic information, you will take in things from social media, from your girlfriends who've had some procedures done. And, that can create a lot of confusion, anxiety, and stress, even. I've had some patients coming in being like, oh, I should have been in here 10 years ago. My girlfriend looks great. And she has been doing these things for the last decade and I'm kind of behind. So I think really just coming in and then finding a dermatologist, a physician who you really are kind of on the same page with as far as, result expectation, someone you feel comfortable, someone you trust. I think that's really the place to start. And, you know, talking about the skincare and then coming up with, an accessible, doable plan that can start to address some of the things you're concerned about. I think that's really the place to start.
Yes, absolutely. Yeah, someone you resonate with, right? Because this is gonna be a long-term relationship. Like, this is like your hairdresser, right? You're gonna really get to know each other, right, in ideal situations. I love this. This has been so much fun. I know people are gonna wanna find you and follow you, maybe come see you. Where's the best place for people to do that?
Yeah, so I'm a board certified and fellowship trained cosmetic dermatologist. I practice at Union Derm in New York City and Greenwich, Connecticut. And you can connect with me on Instagram or learn about me on our website, unionderm.com.
Amazing. I will include all that in the show notes, and I really appreciate you coming on. This has been, so much fun. Thank you.
Thank you so much.
We'll see you next week.